You may be wondering how it's possible that someone who has been vaccinated can still contract measles. Well, the vaccine is highly effective, but highly effective is 95% for one dose and 99% for the second dose. So that still leaves 1 to 5% of individuals who may have been vaccinated but might still be susceptible to measles. If you're not sure what your vaccination status is and if you've received a measles vaccine or not, by all means do contact your healthcare provider, the one who may have kept a record of your vaccination status. You may also contact Ottawa Public Health, who may have kept a record of your vaccination status. And you may contact wherever you lived when you were a child. Any one of those is fine to try and find your vaccination records. You may be wondering if the vaccine, once you've had it, is effective for a long period of time, and the answer is yes. The vaccine is highly effective, as we've already discussed, and once you have it and the vaccine takes, immunity is lifelong. Infants under 1 year of age are very vulnerable to measles because it is highly infectious, and at that age it can cause more severe complications. So because the vaccine is usually given at 12 months of age, it is very important to protect your child by being immunized yourself and by making sure everyone else in your family and in your community as much as possible is immunized so that the measles virus cannot be transmitted to your child. The second thing is that if you are aware of anyone who has possibly had measles, try to limit the contact with that person until you know whether that person truly has had measles or not. And thirdly, really important for infants is the benefit of breastfeeding. Breastfeeding does protect children from infection. It's one of the primary reasons that we recommend breastfeeding. And infants who are breastfeeding will receive antibodies through their mother's milk, and that antibodies should include measles antibodies. So your child will be protected if you can breastfeed for as long as possible.